Dr BMS community, I have compiled a list of about 10 misconceptions and myths about addiction to alcohol, drugs, and addiction rehabilitation, which I have encountered over the years as I've worked to help people recover from these addictions. And today I want to discuss each one of them briefly with a view of debunking them and in the process spreading the correct knowledge out there in the public so that people can know this and use this information to enjoy a better health of their bodies, their minds, and their souls. So without further ado, let's start on this misconception. The first one, and one of the commonest, is rehabilitation does not work. People call and ask, does it work? Can anyone really get cured from addiction? And for those who don't believe and think it's a myth, I want to tell you that yes, it works. I've made videos previously on this subject, and I would today just sum it up and say rehabilitation from addiction works because it is a science. It's a treatment now based on science. It is not guesswork. It's not magic. So addiction formerly joined groups of diseases and illnesses that afflict human beings, and it is classified under mental health conditions. And so the treatments that apply are subjected to scientific rigor and testing, whether they are medication, whether they are psychological interventions. They are subjected to the same rigor of testing and experimentation like treatments in all other diseases. And yes, therefore, it works. There are cases where people do not benefit, they relapse, they go back into their ways of abusing drugs and alcohol after rehabilitation. But this is not reason to say that it doesn't work. I've said previously that just the way someone can get malaria and use medication and get malaria again, or just the way someone can get a disease and they don't get well, sometimes even they lose their lives, it's the same way. So rehabilitation works. There are many people, and in the near future we're going to be inviting some of our alumni, people who have come through our hands at Fountain of Hope, have recovered and are doing well in their life, to give testimony to show that yes, it works. The second myth that I've come across closely is the myth that rehab is like faith healing. People call and ask, is rehabilitation like praying for them? What do you do for them? Do you pray for them? Do you just talk to them? What happens when they come to you? And we tell them that we do everything, including that prayer, everything that heals, but it's scientifically proven treatment. So yes, treatment for addiction through rehabilitation is multimodal. That means we use a variety of approaches to achieve our results. Among them, we use medical therapies. So we give medicines, pills, injections, and such medical therapies that you would find in a classical hospital. We use psychological techniques like counseling, psychological interventions. We have well-defined psychological approaches to helping people who have addiction and other behavioral problems. We use a spiritual approach. We connect them to spiritual ministers and we stimulate their spirituality. So the aspect of prayer, of faith healing could find a yes here, but it's not the typical faith healing that you may be familiar with, that you go, people, a priest or a pastor prays for you, exorcises demons from your head, performs miracles, This is not a kind of shakahola thing of fasting and praying. No. It is practice of spirituality, just like you would practice out there when you are not sick. You may go to church, you may go to a mosque or a synagogue, you pray to God, you believe in a higher being, and that makes you strive to be a better person. And that's what we try to instill in these people. So it's not faith healing, it is scientific treatment using a variety of methods. A third myth that I have come across is that someone is unwilling. Are they going to benefit? People call me and say, "Doctor, I've got my family member who is abusing alcohol, other drugs of addiction." But when I talk to them about rehabilitation, they refuse. They say they don't have a problem and they refuse to cooperate and come. So now, if I force them to come, can someone really get cured if they are not willing to get the cure? And I ask them a rhetorical question. When you take your little son or daughter to the clinic to get vaccination for polio or measles when they were 9 months, and they're afraid of the injection that they get during vaccination, and they start crying, Mommy, I don't want the injection. And you hold them, the nurse tells you to hold them, and they get that vaccination. Does the vaccination work or it doesn't work? So it is the same thing, that when someone is in addiction, we've said it's a disease of denial. A number of them deny that they have a problem, and they do not have the capacity to make that rational decision about seeking care, because addiction or abuse of drugs takes away that reasoning part of your brain. You've seen how a drunk person or someone who's taken alcohol behaves, becomes unreasonable, and does things that are shameful. Now that is just for a short period of time they have been taking alcohol. You can imagine if this has been going on for a long period of time. It takes away that thinking, the reasoning brain. So to depend on this person entirely to make a decision sometimes would be like flogging a dead horse. They may not make a decision. Granted, some make the decision and say, yes, we have people who come in willingly and they go through the rehabilitation and complete successfully or otherwise. But we also have people who are brought in involuntarily. And this is catered for even in our legislation, and this is international legislation. We have the Mental Health Act. Like I told you, addiction is classified as a mental illness. So Mental Health Act caters for these people who may need it but they are unwilling. So we call it involuntary hospitalization or treatment for someone with a mental illness under the Mental Health Act. And so in our work, we receive people who come in through a court order, probation officers. Sometimes they come in brought in by police in handcuffs, kicking, screaming. But we invoke that Mental Health Act and take them in involuntarily. There's a procedure to it. You don't just do it. There's a procedure to it. We don't go out abducting people, like bringing them into the center. Sometimes we receive call, can you come for him? He's unwilling. And we tell them, no, we cannot. Go to the police station, report, get a court order or something legal that we can use to enforce this, and then bring this person in. Even if they're in handcuffs or something, we know that they are sick, they are not able to make the decision, and we'll intervene at that point and start the therapy. So yes, people who are unwilling but are sick can benefit from mental health treatment, from biophysical health treatment, including addiction. The fourth myth that I come across regularly is that, is there a magic pill, an injection you can give them? I have got a family member who needs to get off drugs, to get off alcohol, but they are busy people, they are working or they are unwilling to come. And so I'm wondering if there's some injection you can come and give them, or I just bring them to give them an injection or a pill and we go home and they will be okay. And I tell them, no, we don't have a magic cure like that. You have to go through the process. And the process of rehabilitation takes time because it is about behavioral change. In our country, like I've said in previous videos, the minimum recommended is 3 months. And this is even a short period of time because of financial constraints, being a resource-limited country. In countries where resources are not a problem, rehabilitation lasts longer. 1 year, 9 months, 2 years you're in rehab. Yes, it does. So there is no shortcut in terms of time. You have to go through the process and it takes a bit of time. There is no magic pill that someone can give you and you just get cured instantly. So that's a myth. If someone is selling that, probably this person wants to kind of con you, you know. Those who are selling like the snake charmers, they sell that snake potion for you to consume thinking you get well, but it's all a con because there is no magic pill you give to someone and they just quit. Okay? The fifth myth I want to mention today is that if I come into rehabilitation, I lose my job. I'm willing, I could come, but you see, doctor, I'm working, he's in school, and you'll be sacked. It is a myth that you will be sacked just because you've come in rehab. And why it's a myth is because, as I've said, today, addiction is classified as a mental illness, okay? And so the same way you cannot be sacked because you've been hospitalized for malaria or you broke your leg and you went to hospital is the way you cannot be sacked because of addiction rehabilitation. There are protections in our law, there are labor laws, and if someone is sick, they go to hospital, they don't get sacked. They get a sick leave, and in contracts, employment contract, that is catered for. So when you come into rehab, we facilitate this by giving a medical leave. We write to your employer and we tell them you are in rehabilitation, you are being treated for addiction and other mental illnesses that may be there, because sometimes we have other illnesses, and that is enough. In fact, because of this now, even insurance covers, including SHA, formerly NHIF, SHA covers for rehabilitation. Okay, sometimes in some cases they pay the entire bill of hospitalization. They wouldn't be doing that if it is something that is hushed up or to be done under the radar, or your employer should not know you will be sacked. So you will not be sacked. If you are in school, obviously you lose some time because you have to suspend learning to come and get treatment. But we tell our parents and families that this is very important because there's no alternative. When this person is deep in addiction, they cannot benefit from education, from schooling. And I've made videos. If you check the Dr BMS channel, you'll get these videos that suspend school or college and get treated, because when someone has an addiction, the ability of the brain to get an intellectual nourishment like education is severely limited. And so you better stop education and bring them to school. They will lose a bit, bring them to rehab. They will lose a bit of time, but when they go back and they are cured, they are able to recover. Another misconception, myth that is spread around in this area is that when you come into rehab, you will suffer. You will suffer withdrawal symptoms, you will be in pain, they will make you feel miserable. The terminology that is used is cold turkey. Cold turkey is colloquial termination, terminology, which means that you are getting off you are being used to drugs of addiction the hard way. That lock, that hangover, that craving, like I should just take something, I should puff some cigarette, because you used to having it every day, and if we stop it, then your body reacts by giving signs to you, symptoms to show like, I need that puff, I need that drink. So those symptoms are going to ravage your body and you will suffer. It is not true. If you go to a rehabilitation of repute, like Fountain of Hope, where Dr. BMS is, and many others in Kenya and around the world, you will find you have got doctors, you have got nurses, you have got psychologists, you have got all manners of clinicians and health workers to take care of you. And some of them, their work is to take care of those withdrawal symptoms, to make sure that you are as comfortable as possible. You are not in pain, you are not nauseated, you are not shivering, you are not losing sleep. That is taken care of as part of rehabilitation. So it's a misconception that you will be led to suffer. Obviously, when you're there, this must be emphasized. You will not be allowed to use the drugs of addiction that you are using. We are not going to serve you alcohol or give you cigarettes, but we have got medications and remedies for withdrawal symptoms. You may have heard of methadone clinics. Nowadays, this is common terminology, even in the layman scenario and settings. The methadone clinics are for people who are addicted to hard drugs, the opioids, cocaine, heroin, and because those drugs are very difficult to quit from, then we have to give you something less potent. It's like we are making you come down the stairs from a step that is high to the lower, and then lower until you reach the ground level. We do all this so that we elevate the suffering that a patient may experience. So, yes, we take care of those symptoms. We don't let you suffer. If someone let you think that that's what is going to befall you, it is not true. It is a myth. There's also a myth that rehab is expensive. It's very expensive. And I tell people that actually addiction is more expensive than rehab. Sustaining an addiction, from the money you spend directly buying alcohol and drugs, from the opportunities you have missed because you were stoned, you were drunk, from the repairs you have to do because of accidents, injuries, omissions and commissions, from the court cases, from the police bails. It's just sometimes you've lost your family, sometimes you've lost your job. The cost of addiction is much higher. But talking about rehabilitation directly, right now, mechanisms have been put in place to help people not feel the brunt of expenses, financial weight of treatment. Just like in other diseases, we have insurance. I mentioned earlier that yes, SHA, formerly NHIF, covers that. A number of insurances, when private companies offering insurance, now have a provision for rehabilitation from addiction and other mental health illnesses. So you can tap into this to supplement the family finances, and you get the treatment, the rehabilitation you need, bearing in mind, as I've said, that actually it is the addiction that is more expensive than rehabilitation. There is a misconception also that rehabilitation is like jail. They molest you, they beat you, they dehumanize you, they shame you. No, that is not true. If there is a case like that, I can outrightly tell you that's not a rehab. That is actually something else. It's a quack. Just like sometimes you've had these clinics that are not licensed and they're doing medical procedures, sometimes botched up, they kill, they harm people. Yeah, we have such. We have rehabilitation centers that are not accredited by NACADA, which is our national regulatory agency. They do not have doctors, they don't have nurses, they are not registered by the medical board, the pharmacy and poisons board. Now, these are some of the things you need to check when you are taking your loved one into a rehab. Ask for their registration certificate. NACADA, go to the NACADA website and check, is this rehab accredited? Do you have doctors? Where are their certificates? You're entitled to ask for these things because the law even requires that these things be displayed somewhere in the offices or in the rehab building so that when you go there, you can check, okay? So if a rehab is a bona fide, a deserving rehab, then it shouldn't be a jail. It should not be a place where you are molested, you are beaten, because the therapists there are trained to know you have come in, you have a problem, you are unwell, you have a mental health problem called addiction, and you may even be having other mental health problems, depression, anxiety, stress disorders. You know, we've mentioned that these things can coexist. You may even be having biophysical illnesses, liver disease, hypertension. You may be having diabetes. You may have injured your foot. You have a fracture. So people coming into rehabilitation are really sick people. And so if you're going to turn it to be anything but a hospital, then I think you should rot in hell. Say that. So that's a myth and it needs to be debunked. Lastly, I will talk about the myth that a rehab is for hardcore addicts. Oh, this person doesn't take a lot, you know, he's not for rehab, and rehab is going to mix with people who are alcoholics, and that will affect him. No, not exactly. It's true that some people have to hit the rock bottom before coming to rehab. Maybe they have lost everything, even their home. They're living rough in the streets, they're disheveled, they are mentally disturbed, they have that outlook of a mad person in the streets. We call that rock bottom. But not everyone requires rehab when they are rock bottom. Rehabilitation is required the moment someone starts to lose the control, the self-control. The moment someone starts to show signs like partaking in alcohol or drugs of recreation is starting to be the main activity. All other things are becoming like A or Bs. Going to work, attending to your own cleanliness, to your health, to your family, attending school. When all other things seem to be number 2, 3, 4, 5, but number 1 is constantly having your drink or recreational drug, be it cannabis, heroin, whatever, then you have crossed the threshold and you've lost control. You need to be in rehabilitation. So rehabilitation is not just for hardcores, it's for everyone, anyone who has lost control of how they use recreational drugs. I hope with those few misconceptions, myths I have mentioned, because there are many others, we will talk about them in future videos. I hope this can help families out there who are struggling to make a decision. Do I go? Do I not go? What will happen? Is it the right place? Does it work? Will he be molested? Is it a waste of money? Is it expensive? I hope this can help you make a decision so that you come in early, because it has been shown also that when you start early, the outcome is better than someone who delays and comes when they have hit rock bottom. Tune in again, share this video with a friend of yours who needs this message, and if you haven't subscribed to our channel, please click that subscribe button, become a member of the community. That way you give us the morale to make more videos, and you get notified as soon as a new video is uploaded. We continue helping each other grow our health, body, mind, and soul. Bye-bye.